family doctors are urging Health Minister Christian Dubé to abandon a draft regulation which they say could further limit access to health care. That regulation could prevent them from accepting to take care of a person who comes into their office seeking a walk-in appointment. Told that they will have to justify their choice of taking in the patient. With more on this, let's go to Dr. Laura Sang, family doctor here in Montreal. Dr. Sang, welcome back to the program.
Hi, thanks for having me.
So let's dive into this a bit, right? We talk about Quebecers who don't have access to a family doctor. Yet, they get the flu and they get aches and they get all types of issues like everyone else, but they don't have a family doctor. Right now, as it stands, what are their methods to access the healthcare system, and how could that be impacted by that draft regulation?
So someone without a family doctor, there's a few ways that they can, interact with the healthcare system. They can be calling 811. They can try to speak with their local pharmacist. They can try to get in to a walk-in clinic. And if things are really going in the wrong direction, they can go to the ER. In terms of how this draft might affect access, I think that there's still a lot of options in terms of walk-in, but I think it was more really for obtaining a family doctor through that method. Sometimes what happens is people will go to a walk-in clinic or, will seek care, and then after seeing that doctor, they might be able to have them come on into their practice. So I think it's really that aspect of having that continuity of care that could be affected.
Oh, my goodness. Dr. Sang, can I tell you a story based on what you just said, right?
Absolutely.
So, my fiance and I, we just had a kid in January, right? And in November, I asked my family doctor, hey, when the child is born, can he start to be seen by the clinic, right? And she was a little bit standoffish. She's like, it's difficult, but ask me in January. Once the kid arrives, ask me then, because I can't do anything now. So the baby's born, and I wait for my family doctor appointment. Like I had an appointment with my family doctor. I bring the kid because he's so cute, and he's in he's in the stroller, and I do my appointment and he's there with my fiance, and I'm like, oh, will you please take my baby? And I basically guilted her into taking my baby as a patient, and she's like, do you have any other options? Like, no, we don't. And so she acquiesced and took my baby now in her clinic as a patient of hers. Is that the type of thing that would not be allowed if this regulation goes through?
So I think from what I understood that, there would be some exceptions like taking other members of the family, taking on children, etc. I think we need sort of clearer and more in-depth information on what exactly this entails. I know personally as a family doctor, I do take on a lot of vulnerable patients, and in terms of availability, it's important to have a somewhat balanced practice because if you have just vulnerable patients, they're all going to need care at the same time, and it can become really challenging to have the availability to meet their demands, as well as the fact that, you want to maintain your competencies in other areas. So you still want to be taking on children, you want to take on pregnant women, you want to take on, different people in the population to, keep those skills up. And also everyone should be entitled to care. So while, yes, we need to prioritize the vulnerable, it shouldn't be at the expense of, everyone having access to care.
We're with Dr. Laura Sang, family doctor in Montreal, talking about some proposed changes by Health Minister Christian Dubé. So does this comes down to basically control in a sense, right? Because I guess for the provincial government, for Christian Dubé, what they want, everything's in one line, everything's in one queue. You sign up on this website, and then it just goes through the system. Is that what you think they're after? Control?
I think their goal is, I'd like to believe it's with good intentions to try to make sure that the most vulnerable people are getting the care that they want. However, I think the way that they're going about it with, these strict regulations and restrictions is probably just going to lead to more family doctors burning out or leaving the public system. So I think that, any kind of changes like this really need to be done with family doctors in mind. We need to be consulted. We need to have, our voices heard, our opinions matter, and I think we have a lot of valuable insight that we can give on what we would need to be able to take on more patients and, manage the current challenges that we're seeing on the day-to-day.
Dr. Singh, how do you handle a walk-in? How do you handle someone that just shows up and, they want to avoid going to that ER, that last option?
So I have a certain number of walk-in spots per day for my patients, and I do my assessment, and depending on, how severe their condition is, how difficult it is for them to access ER care, what, the rest of their history is like, then I make a decision, can we manage this issue from home, or do we need to send them to the ER now, or do we just do a short follow-up? But that is a privilege that I have of getting to know that person, getting to know their history, getting to know how they respond to different things. That comes with time and that continuity of care. Whereas when you're being seen in a walk-in clinic, that's just a snapshot version you're getting of this person, and it's a lot harder to, kind of decide how to go about things.
So what would be your recommendations? How would you, what would be your advice if you were consulting with the Quebec government, with Christian Dubé, on how to solve this issue, right, where people just don't have access to that frontline type of care? What would be your solutions?
So I think if they want more access to frontline care, we have, that whole discussion on PREMs and AMPs and the mandatory activities. I'm forced to do a mixed AMP, so I'm only in the office half the time and I'm somewhere else half the time. I think increasing the number of full prise en charge AMPs would really help people have that availability and capacity to take on more patients. And I think that, offering incentives, either financial or, other kinds of things to help make it more enticing, to improve the work-life balance, improve our quality of life, and, help us prevent going on burnout. I think those are all things that would make a tremendous difference in our ability to care for more people and take on more patients and try to make sure that every Quebecer has access to a family doctor.
You mentioned that term AMP a couple of times. I'm not familiar with it, and maybe I should be. What's that? What does that mean?
So it's pretty much these mandatory activities that come to about 12 hours a week that you're obliged to do for your region. So for me, I have to do 6 hours of, clinic with a minimum of 250 patients enrolled. And then I have to do 6 hours, 10 patients at a rehab center. But some other people might have to go into a CHSLD, hospital work, ER, et cetera. So the government controls what I do for a minimum 12 hours a week. And if I do not abide by these regulations, they will cut 30% of my billing. Oh boy, okay, that's a pretty heavy hand right there, 30%. Okay, and just to wrap up here on this on this subject of family doctors and family medicine and what we do in this province to make the situation better. I know the government is they're putting a lot of focus on digital, on internet, on, Click Santé, go here, find your appointment, couple of clicks. How do you feel? What do you feel about that? How do you feel about that component of things? That there's guiding people. Hey, go to the website, get an appointment via the website, get your family doctor, go to this website. Do you think overall that's a good thing, or neutral, or negative? I think overall it's a good thing, and it'll, evolve and become more user-friendly over time. But I think the critical point here is that our most vulnerable population, particularly older adults, are not internet savvy. They have a lot of trouble using phone lines, using the internet, trying to, obtain these things. So if you're really trying to, make sure that our most vulnerable are being taken care of, you're forcing them to use a system that's really challenging for them and kind of makes it easier for young people to get in. But so I think that we still really need, phone lines that are user-friendly, that there's a human that you can talk to that'll help guide people to where they need to go, and make sure that, technological savviness is not a barrier to care, because that's my biggest concern, is that if people can't use the system, then they can't get access to care. Dr. Sang, we have to leave it there. Pleasure talking to you as always. Thank you. Doctor, have a good day. You too. That's Dr. Laura Sang, family doctor right here in Montreal.